You being big, bold, and beautiful is not good for your health, okay? Is this something that can be handled in terms of cognitive behavioral therapy? Is this something that we need to go into someone's psyche to tell them that, okay, you've got to fix this? What is your opinion on that?
So thank you for that excellent question. I'm going to address it in a way you might not expect. So body positivity, so just in case, just to reiterate what Dr. Adenuga has said, body positivity is when you have a positive body image, no matter your body weight or shape. So you're big and you're accepting and you're good. You're not so big, you're accepting and you're good. So I'm going to look at it from this angle. The advantages of body positivity is that it shields you from low self-esteem, from body image dissatisfaction, which we know low self-esteem is a risk factor for depression. And we know that depression can lead to obesity. Yeah. So I'm trying to say that there's nothing wrong with being body positive. Go ahead and be body positive, but also be realistic. So I'm saying body positivity and the reality that. So accept yourself and work towards preventing these illnesses that a big size and obesity can cause. Because if we say, you know, there's nothing, yeah, I'm not saying don't be body positive, because if you're not, it can lead you to the obesity that we're trying to prevent you from getting. What I'm saying is realize that there are real consequences to maintaining the shape. Accept who you are. Don't talk down on yourself. Be self-compassionate. Validate yourself, meaning saying based on this and this that's happening to me or whatever, it's understandable that I am this size. However, I am the driver of the journey of my life, with God and all these things. And I choose also to make healthy choices that would reduce my weight. So that's what I would say about that. Yeah, so let me just add a little bit to that, it's quite tricky, and there are many causes of obesity, to be honest. Some of it very, very complex. Some people have PCOS, for example. Some have thyroid issues and many other hormonal imbalances. And nobody is saying that you're actually the faults of blaming you. Obesity is complex. But when you begin to have health issues, it's always better to seek the care of a doctor. And if it involves you losing weight to have better health, I think that is a very good trade-off. And then you were speaking about some of the effect of obesity, like low self-esteem, depression, and also if you look at it in a cycle self, depression can cause obesity, okay, and obese people are depressed. So how do we break that cycle? Some people, they are depressed, they eat, they become obese, they become more depressed, they eat, so the obesity just continues. And some people, in fact, they are obese, their self-esteem is low, they want to hide in their room, and they are not going out again. They are becoming more obese.
Yes, who tell you that they can't go to social events. I have patients that have operated, they lose weight, and now their status, they're always posting new clothes and all of that. And these are true life stories. So how do we break that cycle of low self-esteem, obesity, then eating, obesity, low self-esteem, and that? How do we break that cycle?
So thank you again. So I think the first thing is this awareness that obesity is not more unidimensional. That, like Dr. Timi said, it is a multifactorial thing. It is not just about what you eat and energy, food intake versus energy expenditure. There are hormonal issues, there are psychological issues, there are metabolic issues, there are a lot of things. So I would say the way to tackle this is to handle obesity, from all angles at once. So if you are going to see Dr. Adenuga, for example, you also bear in mind the psychological background. If you have to see him again, I'm sure he would also do some background tests to check your thyroid function and all the hormones that Dr. Kande has mentioned, to make sure that we target everything. So that's what I would say. So it's a screening that anytime someone who is big comes to see, a doctor who is aware, doctors know their salt, right? So it would be, you'd be screened for these eating disorders and mood disorders, and you'd be screened in a comprehensive manner and treated that way. I think that way